Hello and welcome to Better Living, where we take a holistic approach on what it means to live better. We talk about the intersections of our physical, social, emotional, and spiritual domains, and how a healthy awareness of each one can strengthen our joys and reduce the negative impact of our sorrows. I'm Dr. Neil Ritchie, and it's my pleasure to be your host for this weekly podcast. Thank you for joining in for this week's discussion. Thank you for joining the podcast today. I am Dr. Neil Ritchie, and I'm your host on this journey, and we're just thrilled to have you as part of the listening audience. As you know, we approach our podcast a little bit uniquely week to week. Sometimes we have guests, sometimes I just fly solo, sometimes our times together are a little bit short, sometimes they're protracted. But whatever the case is, we hope that we're adding some value to your life as we seek to reduce the stigma around mental health disorder and increase folks' awareness about different mental health challenges and a holistic approach to treating them. And that's what we're going to do today is we're going to talk about one of the big mental health challenges that some people face, and that is depression. Now, there is no such thing as a one-size-fits-all depression for everybody that's depressed. There are different types of depression. So as I talk about depression today, I'm going to be as generic as I can and talk about it from what I might call a unipolar perspective, like major depressive disorder. But that said, there are different types of depressions, and I will mention them as we go along today, but I am going to focus primarily just on this idea of unipolar depression. When you think about depression, there was a writer that said they researched 50 different people and asked them to come up with descriptions of depression. And what they did was they wrote down 50 descriptions, one from each person, 50 descriptions of what depression looked like for them. And I'm not going to go over all 50 of them, but I do want to hit 4 or 5. One is depression is where you see no future and you don't seem to have an answer for any of the problems in your life. Okay, that's one. Another one is when you have depression, you just don't seem to find any joy. Nothing's enjoyable. Nothing makes you smile. Here's another one. It's like you're a ghost. There's not a single part of you that feels like you're living in the real world. You're just a ghost. And then another one said, it's like drowning, except you can see everyone around you breathing. And then one of the top descriptions, or maybe you might say that one of the most impactful descriptions, was when one of the participants in the study said, depression is a dark, inescapable place, and it's like being locked in a room where there's no light, there's no windows, there's no door. It's so dark that you can't even see your hands out in front of you, and there's no way out. That's depression. Well, why? Why do some folks have such a horrific level of depression? I say a horrific level of depression because let's face it, we all find ourselves experiencing sadness from time to time, right? We've probably all been there. We may even say or have said, I'm feeling depressed today. And we are. We're just feeling in a mood. We're down, we're sad. Maybe we don't even want to get out of bed that day, but that's just a day, maybe a couple of days, but it's not for a week. It's not 2 weeks. It's certainly not for a couple of years, but we all experience some downness. So why major depression? Why do some folks experience that? Well, there are really a number of reasons, but we could categorize them in two areas. One would be what we would call endogenous reasons for depression or internal reasons. And then sometimes there are exogenous reasons for depression or external reasons for depression. And so let's just think about both of those internal and external reasons for depression as we kind of take a history, if you will. If you were to come and see me in private practice, then one of the first things that I'm going to do with you is I'm going to take a family history. And so when you think about it from an internal standpoint, internal reasons for depression, it could be genetics. It could be biology. Those things may contribute to depressions. There are a lot of studies out there that actually show that there is an increased risk of unipolar depression or major depressive disorder in first-degree relatives who have mental health related issues or mental health level of depression. Additionally, depression can be attributed to things like other medical conditions. It could be a neurotransmission issue of chemicals like norepinephrine or serotonin or dopamine or some other neurotransmitters. But maybe those neurotransmitters are out of balance. It's possible for depression to result when that's the case. There are a lot of medical conditions that can contribute to depression from an internal standpoint. There's autoimmune disorders like rheumatoid arthritis, systemic lupus, neurological disorders like Parkinson's disease. These are some of the things that contribute to depression. Sometimes there's hormonal irregularities that cause unipolar depression. Menopause, premenstrual related issues, postpartum in women, low testosterone in men. These things have a way of contributing to depression from an endogenous standpoint or an internal standpoint. But there are also external or exogenous factors that contribute to depression. Social and environmental factors. Reactions to stress and grief have been known to contribute to unipolar depression. There are also things like different medications that could contribute to depression. Recreational drug use certainly can contribute to it. Alcohol can contribute to depression. And so when we understand where we come from or our history of our depression, then from a clinical standpoint, we can discover if some of these items, these external items, are contributing to our depression. For instance, is alcohol doing it? Is it anxiolytics? Is it lorazepam? Is it clonazepam? Is it diazepam? What is it? Is it antihypertensive medication that's contributing to my depression? Inflammatory medicine, is that contributing to my depression? Could it be cold remedies, antihistamines, especially antihistamines that contain alcohol? Is that contributing to my depression? And so corticosteroids, I should say, is that attributing to my depression? Or hormones attributing to it? Cortisone acetate, oral contraceptives, drug abuse, is that contributing? Marijuana, codeine, morphine, PCP, crystal meth. So when we take that history and we start to identify what are some of the external factors in our life, then we may be able to check some things off and say, okay, these are some possibilities as to why I'm experiencing a clinical level of depression. Well, how do you know, other than just saying, I'm down, I'm feeling sad? What are some symptoms of depression? And again, this is not a one-size-fits-all. You may be saying, well, I'm depressed, but you're really not describing me. Well, you may not have a clinical level of depression then, if you're not meeting the majority of these symptoms. So what are some of those symptoms? Well, one is just a feeling of sadness, tearfulness, emptiness, hopelessness, anger outbursts, irritability, frustration. Could be loss of interest or pleasure in most or all normal activities, a loss of interest in sex, hobbies, sport. Could be sleep disturbance. Maybe you're sleeping too much. Maybe you're sleeping not enough. You're tired all the time. You lack energy. You can't even do the smallest of tasks that you used to do. That takes extra effort to do them. Maybe your appetite's reduced, you're losing weight, or maybe the opposite. Maybe you're just craving food all of the time and you're overeating, and consequently you're gaining a lot of weight. That could be a symptom of depression. Anxiety, agitation, restlessness, slow thinking, speaking, or body movement changes that are significant, so significant that a friend or loved one may have noticed. Feelings of worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, trouble concentrating, trouble making decisions, or maybe even remembering things. These are all potential symptoms of depression. And then certainly things like recurrent thoughts of death or suicidal thoughts, suicidal attempts, all indications that one is possibly experiencing depression. When you think about diagnosing as a clinician, when you think about diagnosing someone with depression, there are a lot of diagnostic criteria that need to be met, some of which I've described, and I'll talk more about those in a second. But if someone meets those criteria, then what specific depressive disorder might one have? I mentioned that there are multiple depressive or depression disorders. We've been kind of highlighting unipolar depression. But if it's not unipolar depression, if it's not major depressive disorder, might it be a different type? And the answer is yes. According to the Diagnostic Statistical Manual of Mental Health Disorders, the DSM-5, and incidentally, in I think it was March, the new one came out, and I'm still waiting to get my hands on that one. But some of the depressive disorders that one might be diagnosed with include disruptive mood dysregulation. And that's the case when one has some of the symptoms we've described, and you really are showing signs of temper outbursts, especially in children, that are incongruent with the situation. Then you might have disruptive mood dysregulation. Another one is, of course, the major depressive one that we described. And this is where you've got a depressed mood or a loss of interest or pleasure, and where symptoms have been persistent during the same 2-week period and represent a change in previous functioning. But then there's also persistent depressive disorder. You may have heard the term dysthymia. Well, that's what persistent depressive disorder is. It's depressed mood most of the day, for most days, for at least 2 years. But there are other disorders out there. There's premenstrual dysphoric disorder. There's substance medication-induced depressive disorder. There's depressive disorder due to another medical condition as well. When you think about all of those depressive disorders, there are some common threads or common features to each of them. Sadness, emptiness, irritable mood, along with somatic and negative changes that affect regular functioning. All of these are commonalities in depressive disorders. But there are some differences when it comes to the duration or the timing, or even the presumed etiology or background or history of those depressive disorders. When a person is sure to start meeting the criteria of those depressive disorders, then they really need to seek help from a professional. So if you're finding, or someone you know is discovering, and you're aware of this and you can encourage them, when you start to find depressed mood most of the day, nearly every day, significant diminished interest or pleasure in most or all activities most of the day, nearly every day, significant weight change, appetite change, psychomotor agitation or retardation most days, significant fatigue or energy loss, insomnia or hypersomnia nearly every day, feelings of worthlessness or excessive guilt, indecisiveness, recurrent thoughts of death or suicide. When you start to have these things, experience these things, it's really important to contact a professional. And don't lose heart. Don't, regarding these and think, well, there's no hope, there's no help. I know that that's the temptation, but there is. There is hope, there is help. And we're here for you, and we want to help you. And if you know someone that's experiencing depression, you be a good friend and encourager to them, and you guide them in the path of seeking help. Well, when it comes to treatment for depression, the treatment plan for depression sometimes is just psychotherapy. It's talk therapy. Okay. Sometimes it's more. Sometimes it's psychotropic medication, and there's no shame in medication. Sometimes the good treatment plan will call for both talk therapy and medication. Specific therapeutic approaches might be cognitive behavioral therapy. It could be light therapy. Sometimes depression sets in as a result of the time of year that it is. It's darker outside, it's colder outside. Light therapy is a good solution. Solution-focused therapy, person-centered therapy is helpful. Sometimes it's a combination or an eclectic approach to dealing with depression. Now, there's hesitancy, I realize, to take medication for some folks. I don't want to take medication. I don't even want to talk to anybody, but I will do that. I'll at least talk to somebody, but I'm not going to take any medication. I want you to remember that the primary role of medication is to attempt to restore normal biological functioning, okay? It could be the case that there is a chemical issue in your brain, and so we need those chemicals to come to the table, so to speak. And when those chemicals come to the table through the use of psychotropic medication, then we're able to do better work in talk therapy. So I'll tell clients sometimes, if I'm working with them and we've been working for a while, we're not seeing the progress. We're seeing some progress, but we're not seeing the progress that we would like to see. And it's not because of the therapeutic alliance or anything like that. It's just the theory seems to be the right theory for the situation, but we're just not seeing the progress. It could be a chemical thing, and we may not be able to solve it through some of the coping skills that we are coming up with, mindfulness, breathing exercise, whatever. It could be that we need to introduce some medication. And so I just remind clients, it's not because you're broken. It's not because there's you're needing to be fixed in some unique way, but it's because we're just having some challenges with the neurotransmitters, the firing in your brain. And so maybe we need to introduce something so your brain comes to the table and we can do better work. So the brain contains 100 billion nerve cells, approximately. And each cell creates messenger molecules or neurotransmitters. And some brains have a deficient biochemical process of the transfer of those neurotransmitters, which consequently affects mood regulation. So some brains then have got to have some help with the process. And so that's where the antidepressants come in. And maybe the antidepressants that are used are serotonin or selective serotonin reuptake inhibitors, SSRIs. Sometimes they're SNRIs or selective norepinephrine reuptake inhibitors. Sometimes they are NRIs or norepinephrine reuptake inhibitors. Sometimes MAOIs are used, monoamine oxidase inhibitors or atypical antidepressants. Sometimes there's a hybrid approach that is used. But be open to at least talking with your primary care physician or a psychiatrist along with your professional counselor. Work together, allow them to work together with you as your treatment team, because remember, they're working with and for you, but allow them to work as your treatment team, develop an approach that will help you overall get to where you want to be, which is to increase that life satisfaction. And it is a holistic approach to the treatment of depression. Now, I realize today's been kind of heavy. We've talked about some internal, external factors of depression. We've talked about symptoms of depression. We've talked about diagnostic criteria for depression. We've talked about some treatment methods for depression. If you are experiencing depression, or if you know someone that is, the best thing that you can do is you can seek the guidance of a professional and do that as soon as possible. Work with your therapist, work with your physician to develop the best treatment plan for you. Again, just a pleasure to have you today. Look forward to our conversation next time as we continue to talk about how we together can live better. Thank you for tuning in to this week's podcast. If you have questions or comments, please let us know. We'd like to hear from you. If you enjoy our podcast, please subscribe and you'll be notified of new content. You may also like to join our Facebook and Instagram pages. This week's podcast was brought to you by Better Living and Counseling Services. Better Living and Counseling Services collaborates with their clients to establish goals and identify solutions to help clients toward achieving greater life satisfaction. Better Living and Counseling Services is a telehealth practice providing counseling to Georgia residents. To learn more about Better Living and Counseling Services, visit them on the web at betterlivingandcounselingservices.com. As always, we want to remind you that the Better Living podcast is not a replacement for the counseling services of a licensed professional. Please join us next week as we learn to live better.